Watch. She wasn't at all. It's like, this is ridiculous. Watch on.
Yeah.
Then the cell phones came along. So here I am.
Oh, yeah.
We used to laugh. Dick Tracy.
That's right, yeah.
Now we've all got the new more than the two-way radio. Did you bring that one? Did you magnetic space scoop this morning? You what? Your magnetic space scoop from Dick Tracy? Interesting how comments can
If you ever, that's The Simpsons.
What's that?
The Simpsons. Have you ever seen like how they put the future on this? It is crazy. Like before Apple phones even came out, they had a phone that people were using, and the logo on the back was an Apple logo. And I mean, it's proven like it was like, and it was 15 years before the iPhone came out. They had one of the episodes. It was probably in the early 90s. They had President Trump coming down the escalator, and announcing he was going to be running for the United States. On the escalator, that he was on, like, and it's proven because it was aired. Like the episode there, this wasn't AI. It's not anything else. Like, and there's hundreds of things that they said The Simpsons predicted. Like, and it's like, it's not even general. It's really very specific details that they knew. And somehow it's like if you ever watch like a YouTube video of it, it's crazy.
How are you? Nice to see you. Thanks for coming. How are you? Hello. How you guys doing? Oh my goodness.
I have a message when you're done from Dr. Norman Wood. I have to tell you.
Okay.
It'll be quick.
Hello. Nice to see you.
Good to see you. I always have to give you one of these. You know what it is.
I know what it is. It must be. How are you, sir?
Welcome to my district.
It's good to be back. Delegate.
Governor, how are you? Welcome to my district.
Good to see you.
Yes, good
It's nice to see you.
Great day to travel.
We love it when you keep coming back our way.
You kidding me? This is a favorite of mine to come up here. All right. I'll tell you what, do I need this for I do. They tell me I need this for the TV, so therefore I'm going to use it. But I think all of you can hear me very well, and I'm not going to, have a long speech with too much scripting. But I want to say to the people in the Northern Panhandle and all across West Virginia, we have a unique opportunity, unlike anything we've had in a long, long time. And it's exciting to be up here because I know that during the process, when we submitted our rural health application grant, we received feedback from people all across West Virginia, including many people in the Northern Panhandle. It means a tremendous amount to get the feedback from people all across the counties in our state. We live in an amazing place, and we know that people love West Virginia. If you live here, you know how special a place it is. But one of the things we found as we keep diving into different ways to help our state lift up and reach her potential is that we kept looking at the correlation between poor healthcare outcomes and low workforce participation. And the more we looked at that, we knew we have to do something about it. So interestingly, I've been having discussions with the Trump administration now since the beginning of his term about the importance of rural health and how we can improve healthcare outcomes in the state of West Virginia. And those have been terrific because we know that the Trump administration is aligned with the work we're doing here in West Virginia to improve healthcare outcomes because they understand the basics and the cycle that we have. If you can improve people's health, make meaningful impact when you're looking at obesity, you're looking at COPD, diabetes, congestive heart failure, and you're able to stay in the workforce longer, then you're going to be able to contribute more to our state's economic strength. Good healthcare outcomes means more people in the workforce. More people in the workforce leads to stronger economy, higher workforce participation, and ultimately that feeds back in for the ability to attract even more people to our state. It's an exciting thing because when you have a good economy, a strong economy, that also helps address a lot of the challenging healthcare outcomes that we have. So we have a chance with this rural health application to do things from a healthcare and an economic perspective that we haven't seen before. And we've spent a lot of time. I spend well over 90, probably 99% of our time always focusing on ways we can drive economic strength to our state. And this application represents a key to that. So what we've done is we've developed an application designed to improve the affordability of healthcare in West Virginia and the accessibility of healthcare. Those twin goals ride all the way through the application. And when you can improve affordability, you're sensitive to what's going on right now, where we have to deal with really difficult conditions that, quite frankly, were left over from the Biden economy that were challenging. Inflation, some of the loss of economic opportunities. We have to double down and keep addressing that and reducing prices in healthcare and making it more affordable. That should be central to the goals that we have because of the relationship of healthcare outcomes to more people in the workforce and what that means from an economic perspective. So we believe that workforce participation strength needs to be the top goal that we have as a state, period. A lot of people talk about different things. In my mind, it's 1 through 38. And obviously that means you have to do a lot of things to lower the workforce here. We're going to talk about some of them today. But this is an exciting time, and I think it truly can be transformational for the state of West Virginia. When healthcare becomes more affordable, it relieves pressure on families, on small businesses, and taxpayers who shoulder the cost of inefficiency. It's going to restore energy and opportunity to all the people we love, and it's central to making West Virginia the best place to live, work, and play. So that's why this moment matters, and I wanted to come and spend a little bit of time traveling around West Virginia to explain what we put in this application. But I also want to take you back to a moment in March. Many of you may remember back in March when we rolled out a number of pillars of health, because we were thinking back then of the importance in healthcare to our state's economy and ways we can make West Virginia a more vibrant state, a place where people can work with purpose, with pride, and raise their families with hope for the future. We announced a number of fundamentals as part of this healthcare plan. One was to clean up the food system. Get the crap out of the food. There's a lot of crap in the food. We need to make progress in that area. We are. The law that we passed related to some of those terrible dyes that were in place, we know that that's being used as a model nationally. And we know now that the standard that they're going to have in place, we think will end up working for the whole country because of the momentum that we've seen. Second, we know that we wanted people to work with purpose. And we've been working closely with the Trump administration on a number of the work requirements. We think that's important. We want to get more people back to work. We talked also in terms of trying to get people more active. That's critical. Hang on one second. I was about to sneeze, but not right now. So we wanted people to stay active. You guys may remember back in March that I announced that we were kicking off the Mountaineer Mile. Well, that's been very positively received, and we're looking to get even more penetration of that across West Virginia. I can tell you that on that day, I promised to the people of the state that I would try to lead by example and at least walk a mile every day. I can now report to you that since March 29th, I've not missed a day, and we've been averaging over 12,000 steps from the beginning. It's a pretty cool thing. Now, I'm not here to tell you that that's perfect, and I certainly have plenty of challenges, but I can say this, that's led to a change, and I'm down 12 pounds since the beginning. A lot longer to go, and I'm not here to take a victory lap. I have a lot longer to go. But the point is, if I can do it, and I know it's not been easy, then I think everyone can do it. And just imagine what happens when more people are walking, more people are moving, they're exercising. I'm really excited. One of the planks that we have within our Rural Health Transformation Fund is bring back the presidential fitness test to West Virginia. And we're excited about that. Having competitions between schools, between counties, about ways that people can move more and get better. That's a wonderful thing to do. So a lot of progress on what we're doing, but we also know that there's a lot more work to be done, and that goes to what this effort is that we've applied for. This Rural Health Transformation application that we submitted yesterday will provide, at least if it's accepted, at least $100 million per year to try to improve rural health outcomes in our state. That's significant. If we're fortunate, we can get a bit more than that. I'm going to be working and pressing our case to people in Washington very aggressively to get the help that we need, because it'll matter for West Virginia communities. We know that these are investments that are designed to make healthcare more accessible and more affordable. You're going to be hearing a lot about that. We need more access, and we need healthcare that's more affordable. I think a lot of the work that we're doing within this application is focused with that in mind. Now, I'd like to walk through some of the core ideas in our plan just to give you a little bit of a sense of what we're working on. It's exciting. We have a practical roadmap for success. I'm going to start out by mentioning one of the challenges that we've had here in West Virginia. And I'm here in Marshall County, and I know that there are challenges sometimes of accessibility. There might be people in various hollers and places that have a difficult time getting the healthcare they need. We want to change that. And so the first plank addresses distance problems that we have in West Virginia to be able to see the healthcare provider of your choice. We want to make it so that it's easier for you to either physically go and connect with the provider or have the provider come to you through telehealth opportunities, whether the telehealth facilities are set up through a hospital, a federally qualified healthcare center, a clinic, or even maybe at a library. That's an opportunity for people to get better access to healthcare, and that's one plank. We're also looking to support EMS treatment, allowing them to actually have more rides and more opportunities. Some of the EMS groups are really hurting in West Virginia. This allows a little bit more resources to go to them on the transportation piece. And then that leads to the next part, which is the availability of transportation. We intend to set up a one-stop health mobility platform that's going to connect the medical transportation to the public systems that are out there, once again, facilitating the movement of people from place to place. We think that's important. Then our third initiative focuses on improving workforce. I'm going to say a couple words. I'm going to be repeating them a lot. West Virginia needs to recruit, retain, and retrain. Recruit, retain, and retrain. We have shortages of a number of healthcare professionals, primary care physicians, specialists, nurses, pharmacists, lab techs. We need to change that. So what we want to do is we want to continue the existing incentives that the healthcare community has been doing and build upon them. And that's what we're going to be doing through this application, because we need to make sure that we're addressing the accessibility issues. But by also doing that, we're increasing workforce participation, which also benefits the economy. So our Mountaineer Care Force is our workforce recruitment effort, and we're really excited about that. I think that's going to lead to great things in our state, and it builds upon all the economic work that we're doing focusing on workforce. Because I think we have a chance. We have a lot of existing jobs, and we're trying really hard to have West Virginia be a net migration state, but also build up the skill sets that people have here in West Virginia, the homegrown talent, and keep them here. That's got to be a big part of the equation as well. So Mountaineer Care, recruit, retain, retrain, very, very important. We're also supporting community and technical college faculty positions. In our conversations with the Higher Education Policy Commission, we found that it wasn't just the availability within technical colleges that were an issue, that we need to create more faculty positions so we could actually educate more, especially when you're looking for these opportunities in healthcare, or when you're looking for opportunities as an electrician or a plumber or a contractor or a sheet metal worker. So we're excited about that. We also want to modernize a lot of our healthcare systems to make sure that providers and consumers can help save money. We want to make sure that the savings that we're providing get passed back down to the consumers. That goes to the affordability that's so important within our healthcare system. So we're excited because we're going to be spending a lot of time with our healthcare systems to collaborate with them and look at value-based care models so we can improve efficiencies and help ensure that access is maintained. That is important. And it's also critical to know that part of what we're trying to do is to invest more at the front end in technology, in a lot of the prevention, so that we can see a reduction in expenditures at the back end, both for West Virginia, our citizens, but also on the federal level as well. I'm always fond of saying an ounce of prevention equals a pound of cure. And I think that we could bear that in mind. That's a big part of our application. We also have a health to prosperity pipeline we're building to make sure we can get more people to work, connecting recovery and wellness together with employment, so we get more people going. If you can get people even healthier, they might be able to work part-time, they might be able to work full-time. That has to be a big focus. And so we're excited about the initiatives in our application to promote that effort. Expanding recovery to work programs, partnering with employers on wellness initiatives, and rewarding transitions from Medicaid to commercial coverage. That's a big goal of ours. Our next big initiative, we're very excited about this. It really captures the Make America Healthy Again movement. We're looking to emphasize movement. I've talked about that before, the context of the Mountaineer Mile, but also ways we can help address the diabetes challenges we have, the obesity challenges in West Virginia. Think about using food as medicine. We talked about getting the crap out of our food, but it matters a lot what we're putting in. So we want to empower West Virginians to lead healthier lives, and that's going to be very beneficial. We might have education, wellness rewards, support for caregivers, a lot of opportunities to enable us to better tackle the chronic disease prevention that's so needed in our schools, in our workforce, in our communities. Finally, last but not least, we have an initiative we call Health Tech Appalachia. We know that the world is changing rapidly. It's moving toward a high technology area. We want to make sure that we're utilizing all the technology tools to help make our people healthier. And so we've identified in West Virginia, there are a number of big economic opportunities and entities that are on the forefront of producing so many incredible devices and practice areas that could lead to wellness for our citizens. I'm always happy to cite one, RNI, the Rockefeller Neuroscience Institute. They're doing some world-class, high-class work. It's unbelievable what they're doing in terms of in the area of addiction. We want to make sure that we're encouraging that, not only to have the devices that are needed, but to make sure that our citizens are benefiting from their products. And as they have good ideas and they're developing devices, we need to commercialize those products, not only leading to health, but expanded economic opportunities. We also, within this fund, have the ability to invest to make sure that some of the healthcare companies should locate here as we become the heart of healthcare transformation. So this is an exciting part of the plan. Now, I want to say thank you to so many of the people who have made this possible. I want to start out by thanking over 40 of the healthcare associations and groups out there who have endorsed this. That matters a lot. And that list runs deep. It's not just the Hospital Association. It's not just WVU or Marshall. It involves people across the gamut. We had an extensive effort to recruit public comments. We asked people to comment. We have over 3,000 pages of comments. And I can tell you, I've read many of those comments. And there were a lot of thoughtful recommendations that were included. Beyond that, we also had 3 roundtables where we sat down with over 35, 40 people. Our team conducted interviews with over 40 different sets of entities and groups, met with all of our relevant state agencies. This is collaborative with our state agencies, but of course, the private sector has to really lead and lean forward on this. So this has been an effort to get engaged with a lot of people. We are also proud to announce we have support not only from our federal delegation, but from our House leadership and the Senate leadership. And we've given our legislature opportunities to weigh in and provide input. And we're obviously asking for their authorization of this. If we get the award, we're going to want to work collaboratively with the legislature to ratify what we've submitted to CMS. So we want to work together with people and want to make sure that the good work that we've done really pays dividends for our people. But at its core, this is about ending kind of the vicious cycle that's existed in West Virginia, where we've had the worst workforce participation rate in the country, and a lot of that's been fueled by poor healthcare outcomes. If you increase and improve the healthcare outcomes, if you make big changes there and you get more people healthier, that's going to feed into a larger and more productive workforce. When you have a larger, more productive workforce, that makes your economy stronger, lifts up your standard of living. When you have a higher standard of living and a stronger economy, that feeds into making people healthier. So that's the positive cycle that we're trying to create through this. So this is a once in a lifetime opportunity. I'm not aware, I'm 57, I'm not aware of anything I've ever seen to date where people are making these kind of resources available up front for prevention, to get out in front of the problems before the resources get spent at the back end, emphasizing wellness and prevention rather than paying as much, because it's a very heavy price at the back end. So I'm excited about this. I think West Virginia should be excited about it. It's a new era for affordability and for accessibility. We're going to leverage the technology tools that we have. We're going to grow our workforce, and this can be West Virginia's moment to really be a model for the rest of the country. So I'm going to get to work, hopefully with all of you and all the people that are watching, to make sure that this is the success it's intended to be. So with that, I want to say thank you all for coming, and I would ask if the media has any questions. Jocelyn, do you want to start? Nice to see you, young man.
Yes.
I don't want to put you on the spot if someone else has questions.
What seems to be the biggest health problem in West Virginia right now?
As you know, Jocelyn, there are a lot of disease states where West Virginia is unfortunately ranked at the bottom. If you look at obesity, you look at diabetes, you look at the prevalence of COPD, you look at congestive heart failure. There are a lot of areas that we think we could make meaningful improvements. And when you make those improvements, they feed into the system. So we're trying to take a lot of those head on and to make strides there. We're actually trying to make improvements, further improvements on the substance abuse side. We're going to have models to address diabetes management, obviously obesity. We're taking those on through a number of the initiatives within. And if we can make major progress, that's going to lead to more people going back to work. So it's a long list in terms of the challenges we have, but I think it's also an opportunity for West Virginia to lead, to demonstrate improvement quicker than people. The key is we need to start and get going, because while it's a 5-year program, we want people to get to work on this right away, and the resources could flow as early as January, assuming it gets approved. And obviously we have to get the legislature to authorize the application we sent in. But if all that happens, I think, within the first couple of years, you could start to see some progress from our initiatives.
We talk about the people who can work but aren't working. Has it been broken down in percentages, how many have health issues and how many don't?
We found that that's the most significant driver as to why people are not working. And if you look at West Virginia's workforce participation rate, the principal reason deals with disability and poor healthcare outcomes. So part of the goal behind this is to change that, because if we can reduce the number of people that really aren't healthy enough to work, that's going to feed directly into the workforce participation numbers. So it's my understanding West Virginia has the highest disability incident rate in America. And so it's part of my goal to change that. And part of the way you change that is by improving healthcare outcomes. So this is a very focused effort on that. And it's based upon the belief that if you can improve healthcare outcomes, you can improve people's lives and get more people to work. We have seen studies, Jocelyn, that only a very few number of people actually don't want to work. People want to work. You just have to make sure they're healthy enough and have the opportunity to work. And we're working overtime, fixing the fundamentals on economic development. We're doing more than anyone has seen in a long, long time. And people are going to see the fruits of that as you start to see these announcements coming through, not through the benefit of $4 billion of federal resources, but through the benefit of the ingenuity that we've tried to bring by investing in our people and leveraging our existing resources, including energy. We have an energy summit next week. We're going to be making some economic development announcements that are very exciting. So, but the healthcare outcomes and the economy and the workforce, they're tied inextricably together. Question from TRF. TOV?
Yeah, so those that are getting out into the workforce now, recent graduates, what are you wanting to let them be aware of going into West Virginia and staying in the state, whether it's further education or growing up there?
I'll tell you what, it's a great question, and I'm really glad you asked, because I think one of the things we have to do is let younger West Virginians know there's an incredibly vibrant future in front of them, not only just through this program, but all of the economic development initiatives we're working on, because we're working on the fundamentals. It's exciting. Look, I know some people like to just run around and tout the press release and say everything's great, but when we came in, we knew we had to work on the fundamentals, the site selection, the readiness, the broadband, the energy capacity that we have in place, and investing in our people. I can look at people straight in the eye and tell them there are so many good paying jobs that are available today and will be available into the future because of the transformation that's going on. So this is an exciting opportunity. And let's say you're interested in healthcare. Let me tell people what the opportunities are. They could be in the area of health tech. Let's say building out what R&I is doing, what Marshall is doing, what the O School and other people are doing. That's one area. It could be in terms of new pharmacy jobs where there's a shortage, lab techs, doctors that we could bring in, unlimited opportunity. So that's one area. There will be manufacturing jobs that are coming in as a result of this. That's incredible. So these are going to be high-paying jobs that people are not only going to want to stay in West Virginia for, they're going to move to West Virginia and help improve our net migration. I think this is the best opportunity for young people. And one of the things we're going to do, we're going to involve young people in this health transformation. They're going to participate in contests in the schools, schools against schools, counties against counties in terms of getting people healthier. I think that's exciting. And I think that's a fundamental part of what we need to do. Great question.
Another question with young people in mind, those that are freshly turning 18 and getting into the involvement of West Virginia, what would you want to tell them about the future of that?
That we have an incredible future that they should be a big part of, that they can influence that future because there's more dynamic activity happening in West Virginia now than ever before. When you start to see some of the announcements that'll be coming in upcoming weeks and months ahead, when you see that we've invested, we used the last legislative session to focus on licensing reciprocity. As a result, in a number of areas, we've seen 10% uptick in terms of the applications in a number of areas. That's great. We've invested to try to make our regulatory system better, to cut red tape faster. That's very attractive for businesses. And also, we're taking advantage of our energy resources to really be at the center, the intersection between energy and technology. There are going to be unbelievable job opportunities. And then this announcement today, healthcare, rural healthcare opportunities. So I guess what I would say is, I'm the one who will always point out, I'm going to be honest with people. There are challenges ahead, right? We have to move. But we're committed to the type of measures that are needle movers, will make a big difference for our state. And that's the message today, that this is an incredible place. I think our young people know that we have unmatched beauty in our state and that this is an incredible place to grow up. But I want to assure them there's going to be it'll be incredible job opportunities into the future. And what I'm talking about is just another very good example of that. And I'll build on that one point. When you have $1 billion of these investment, let's say we have the 500 million private sector and other resources, what people tell you is that there's about a 2.5 times multiplier with our GDP. That's a lot of opportunity for new jobs, new investment in our state. That should make people really excited.
What are some of the challenges that you're going to face with this rural health initiative, rural health transformation? How do you go about overcoming?
Well, look, I mean, we know that we start at a place, and for many, many years, there hasn't been enough work put in place to kind of change that, the fundamentals where we're challenged, where we're not ranked at the top, right? So now we're putting in the hard work. It doesn't show in a few weeks, it take a few years, but we're doing the right thing from a fundamental perspective. That's exciting. So what are the challenges? Well, look, when you're 50th in diabetes or in some of these areas, you don't turn it around on day one. People that think you can, I mean, they're out of their mind, right? You have to make the improvements and get to the fundamentals. We need to make sure that we're going after kind of the core reasons driving a lot of these healthcare conditions. That's what this application begins to do. And so one of the challenges, though, is this is coming fast. We had to put an application together in a very quick period of time. We had to get outside help to put it together. We have to make sure the CMS will decide by the end of the year what they're going to do. And I'm going to spend a lot of time trying to help convince them that our application is really good and worthy of funding, right? But then the implementation begins in January. We'd like to start getting money out the door January, February, March, first quarter if we can. That's hard, but we have to build an infrastructure to allow that to happen, because you're talking about $500 to $800 million public monies, and then you're talking private sector leverage. That's a lot. So we have to make sure that that's moving fast. But I'm really encouraged by the people of West Virginia and all the healthcare community coming together, because that's what's made our application so strong. And I think people will be very pleased. And but I got a lot more work to do. We got to go and advocate for this and get as much help as we can to get as many resources as possible from CMS.
So what does the application process look like for this?
Yeah, so there are a series of requirements. It's actually a pretty detailed process that they have a formula for how much states could possibly get. And so you have to check boxes. Some of it is out of our control because it deals with various factors, which measures how rural you are, your population, and other statistics. And so some of them we score well on based on the formula. Some of them we don't, just based upon how the statute was written. But I will say this, then you get graded by your application. And so you have a 60-page application that you send in, and you have an appendix, and you have a budget, and you send it in. And then, of course, you build support for it. That's why we've talked to the federal delegation. We've talked to our legislative leadership, and that's why I'm encouraged with the strength. But also we're demonstrating that we have a lot of people in the community who are engaged with to make this application strong. I can also volunteer. I've talked to some of our other neighboring state governors, had a good conversation with Mike DeWine about different ways that we could work together, Ohio and West Virginia coming together. They're cross-border issues. And if there are things that one state does really well, awesome. And then there are things that we do really well, and then Ohio comes in, that's great too. The object is to help our people. And so, but there's a lot of work to do. Changing difficult statistics doesn't come with just thumping your chest. It takes a lot of hard work, and that's what we're dedicated to doing. So, but we're excited about it because this is unique. And we're going to have, I think we have a good plan for how these resources can get spent. And we're very hopeful that CMS is going to look favorably on a lot of the work that we've done. Jocelyn?
This application's being sent to what agency?
I'm sorry?
What agency is getting this application? Where's
CMS, Center for Medicare and Medicaid Services. So we submitted it yesterday, and we're going to eventually make it public as well. We're trying to work with CMS on all those details, but I think it's important that people will see. And we have a detailed summary we can also provide to you, Jocelyn. Annie, I don't know if we have it here, but we can print it out. We want to make sure you have what you need. You may have received it yesterday as well when we announced it. But what I'm trying to do is go out and talk to people and make sure folks know what's going on. And I'm grateful people are here because this is pretty important. This is the single biggest healthcare announcement we've seen and the biggest investment in terms of raw dollars to actually try to improve healthcare outcomes, not just treat you on the back end when you're sick, but to prevent a lot of these absurd expenditures before they ever occur. That's great. Any other questions from the first for the media, and then I'll separately deal with the public.
How long is this money for? How long is it?
It's a great question. So it's a 5-year program, and if we're successful, it's a minimum of $100 million per year. Obviously, I'm not the scorekeeper, so I don't know how much money they're going to give us, but I'm going to make a compelling case. If ever there's a state that would benefit from rural health transformation, which leads to increased workforce participation, which leads to a stronger economy and a higher standard of living, it's West Virginia. And I want to make the case why this is a great opportunity for CMS to say, look at what West Virginia is doing and the improvements they're showing, and that could be a model for the rest of the country. So any media questions, further media questions? I'll come down for the public questions, but I want to say thank you for coming. I appreciate it. And we're getting around the state today, and I'm excited with the reaction so far. So thank you and God bless.